It's Dr. Monty with Geek Rehab. I'm going to show you a couple common tapings of the knee that I use almost every day in the clinic. I find a variety of populations that could utilize these tapings. And this first one is to help decompress the pressure of the patella. Sometimes you'll get a diagnosis of chondromalacia patella, which is just the patella is tight, pushing down underneath, causing inflammation underneath that patella. Also, it could be causing some patellar tendonitis right here, or bursitis. So the other diagnosis could be Osgood-Schlatters disease, which is often in adolescents that are growing. You get a lot of pressure on this bony prominence where the patellar tendon is pulling and causing stress and strain. So this one tape job kind of helps a lot of those, just to help decompress the patella and decompress that patellar tendon. So I went ahead and pre-cut this. You want to go up a little bit on the quads and make sure it comes over the kneecap and just a little below. You want to apply this with 10% tension, which is basically just pulling the paper off and applying it at that same tension, because it's on the paper with about 10% automatically. And just go straight over the patella in a flex position. Okay, so Doug, let me have you bring your foot back just a little bit more there. Perfect. Okay. Now, if we do this right, if you have too much tension and you straighten your leg, it's going to be kind of flat. But if you do this right and you straighten your leg, there's going to be a lot of wrinkles in there. And that's pulling away on the skin and the pressure and causing some decompression. That's when you know you got it right. So let's see how you do. So we see where the kneecap is. You want to go right along parallel to it. And see, I take about 1 inch off. And I put that down with no tension. Okay. And now, as I pull the paper off, I'm going over it with my hand just to lay it down for that 10%. And then again at the end, see there's no tension there, then I lay that down. And you want to rub it on, get the adhesive activated. All right, Doug, go ahead and straighten your leg up. That's what we're looking for. All those wrinkles, okay, all those convolutions is pulling the skin up, pulling the tissues below the skin up, and decompressing all of that that's underneath the tape. That's what we want. The more wrinkles, the better. I'm going to show you another tape job, and it is to help decompress the inferior or distal or lower part of the kneecap. And this helps, it's another way to help reduce patellar tendonitis, all right? And basically, it's for the inferior pole or the lower part of the kneecap to help give it a lift. Okay, we all need a lift. So I pre-cut a piece of tape, and you take it in a minute. You want to put this on in also in a bent position. And oftentimes I'll outline the kneecap so I can get an idea where I'm, make sure I cover this, get my targets. And we're looking at the bottom of the kneecap, right there. Already it looks a little happy. We got a couple of eyes, a happy face. Okay, so I try not to touch the tape. All right, get the ends, and I do a little bit of tape. See, that's the inferior part of the patella. I try to get just a little bit above it, and I give an upward force so it lifts. Okay, and you can go anywhere between about 25 to 50% tension. And at the ends, there's no tension, okay? And you see, it's a happy face. They're happy. Less pain, takes away the tendonitis, lifts that inferior pole of the patella. And that really helps with a lot of the pain control.